male, 5 years old, the son of Suhail, admitted, resident of Badami Bagh, Lahore, admitted 5 days back via emergency with presenting complaint of fever since 1 week and body swelling since 6 days. My patient is a known case of nephrotic syndrome. Historian is his mother, and according to her, he was in usual state of health. 1 week back, then he had fever. It was fever was sudden in onset, high grade, documented, continuous up to 103 degree Fahrenheit, documented, and there was no relieving factor, and there is no diurnal variation. It was associated with chills and burning micturition. However, there is no history of headache, fits, ear discharge, flu, sore throat, vomiting, diarrhea, vomiting, loose stools, chest pain, shortness of breath, or cough. Patient had body swelling for 6 days. It was gradual in onset. It started from periorbital region and involved whole body in 6 days, including abdominal distension, scrotal swelling, bilateral pedal edema. Bilateral pedal edema. There is no diurnal variation and there is no relieving factor. There is no history of jaundice, hematemesis, prolonged diarrhea, shortness of breath, palpitations, orthopnea, hematuria, oliguria, or anuria. With these complaints, patient was taken to Tertiary Care Hospital in Lahore, where he was admitted and investigated with blood test and urine test and BP recording, and he was managed with IV injections, IV albumin, tablet delta cortical, 8 tablets, once daily dose, once daily, and gastroprotective syrup and calcium supplements. However, there is no improvement in abdominal distension, and there is no plan to discharge the patient at present. Actual history of my patient dates 8 months back, when my patient had body swelling. When my patient had body swelling, it was gradual in onset and started from periorbital region and involved whole body in 3 days, including abdominal distension, scrotal swelling, and bilateral pedal edema. There was no diurnal variation and no relieving factor. With this, there was no complaint of jaundice or hematemesis, no urinary complaint, or no history of loose stools or shortness of breath. With these complaints, patient was taken to Tertiary Care Hospital in Lahore, where he was admitted and investigated with urine test and chest X-ray. Blood tests were done, and patient was started on tablet delta cortical, 8 tablets. 8 tablets once daily with the gastroprotective syrup, and IV albumin was given, and IV albumin, and with this management, patient condition improved during the hospital stay, and he was discharged after 10 days with home monitoring for proteinuria by boiling method, and follow up after 3 weeks. According to mother, they did not check proteinuria at home and did not visit hospital again, and they stopped tablet delta cortical after using 3 more weeks with total treatment of 1 month. And they discontinued tablets by themselves without any medical consultation. Patient remained symptom-free for 1.5 months, and he again developed body swelling of similar kind, and he was again visited. He again visited Tertiary Care Hospital in Lahore and was again started on full dose treatment of steroid tablet delta cortical, 8 tablets. This time, steroid as patient was again admitted, and as body swelling improved, he was discharged steroids were tapered, and the steroids were tapered, and the full treatment was completed in 3 months. Um, Course of disease is complicated by heartburn, bony pains, relapses, and heartburn, bony pain, and relapses, the muscular and body aches. With this, there is prior to this illness, there is no history of febrile illness, glandular swelling, and oral nasal ulcers, alopecia, oral nasal ulcers, history of hair fall, joint pains, any chemical or factory exposure, bee sting, okay, or bee sting. There is no history of with all course of there is no history of one-sided weakness, skin lesions, or no history, sudden shortness of breath or chest pain. And the home monitoring is done with the boiling method, and mother is maintaining a chart for it. And there no previous procedure is done to this patient at till date. His birth and vaccination, his birth and developmental history is insignificant, and his birth and developmental history is insignificant. He is vaccinated according to EPI, and there is no additional vaccination advice to this child. However, mother is aware of avoidance of live vaccines while patient is on while patient is taking steroid treatment. He is taking usual family diet with and following salt restriction. He's product of consanguous. He's product of consanguous parents, and he has 2 siblings, and he's third in order. With all other siblings are healthy, and there is no family history of kidney disease. And he belonged to a poor socioeconomic class. With his father is a laborer, and they live in a rented house, and disease has a significant impact over patient and parents, psychologically, socially, and financially. And mother has average knowledge of disease, and she don't have any knowledge about sick day rule, and she is concerned about her child's well-being and long-term outcome of the disease. On examination, 5-year-old boy who is conscious cooperative during my examination. He has normal build with IV line over the right dorsum of hand. He has height of 100 centimeter, which is at 50th centile, and he has weight of 20 kilograms, which is at 90th centile. He has temperature of 98 degree Fahrenheit, with respiratory rate of 24 per minute, and pulse of 86 per minute, and blood pressure of 100 by 70 millimeter of mercury, which is normal for his age, and which is normal for his age and sex. And my patient, he has generalized body swelling, including periorbital puffiness, abdominal distension. He has generalized body edema in the form of periorbital puffiness, abdominal distension, scrotal swelling, and the bilateral pedal edema up to extent is up to mid shin. He is not pale, jaundice. There is no pallor, jaundice, clubbing, no oral nasal ulcers, no alopecia, no thyroid swelling. BCG scar is present, no lymphadenopathy. BCG scar is present, and orodental hygiene is normal. Abdomen is distended with the central slit-like umbilicus, and there is it is soft, and there is no visceromegaly. Bladder is not palpable. Shifting dullness, the fluid thrill is positive, and the bowel sounds are audible. Vowel sounds are audible. Chest is normal. No, chest is normal shape, and there is bilateral decrease air entry and dull percussion note, with decreased vocal resonance bilaterally, and there is no added sound. Uh, there is no sacral edema. Back is normal. Um, uh, uh, Back is normal. Gait is normal. Cover sound is negative. Um, there is scrotal edema present, and uh,
Okay.
madam हो गया.
Okay. So anything else you want to do in your patient? Okay. Anything else you want to tell?
No, madam.
Okay. All right. Would you like to go for fundoscopy in your patient?
Blood pressure is normal. There is no sign of raised ICP, so no.
Okay. Okay. What is the birth history? What was the gestational age of your patient? And what was the birth weight?
He was born at full term and born at hospital, and there was no immediate and weight was normal.
Okay.
No complication at birth.
Was that important to investigate?
Yes, ma'am. वो
Why?
जी मैडम वो congenital के लिए और
Okay. Was there any history of the rash in the mother during pregnancy?
no. Torch
No.
के लिए मैडम no history of rash.
Okay. Or okay. Is there any
मैडम
restriction?
एक कॉल मुझे बार बार आ रही है मेरी मदर की. मैं
Okay. Okay. You can do.
मैं